As you have already heard, the patient is presently hospitalized in isolation at this hospital. The patient is a 33-year-old doctor working with the famed human services organization, the Doctors Without Borders, or Médecins Sans Frontières, in Guinea. He completed his work in Guinea on the 12th of October and left Guinea on the 15th of October via Europe, where he arrived in the United States at JFK Airport on the 17th of October. At the time that he departed Guinea, throughout his journey home to the United States, he was well with no symptoms. When he arrived in the United States, he was also well with no symptoms. And he, being a medical doctor, undertook to check his temperature twice a day, which he has done since he departed from Guinea. On the 21st, he began feeling somewhat tired, but the first actual symptoms that the patient displayed were today, sometime between 10 and 11 this morning, when he experienced a fever and contacted MSF, who rapidly contacted the health department, and the process of bringing this patient to Bellevue Hospital as a person considered at high risk for Ebola began. We know that during the time that the patient was home before he became sick, that he did leave his apartment. We are aware that he went on a 3-mile jog, sign that he was feeling quite well. And he also took the subway system. We know that he's ridden on the A train, the number 1 train, the L train. We're still getting more information about this, but we know that yesterday that he went to a bowling alley in Williamsburg. He was feeling well at that time, and except for his feeling of fatigue. And once again, his first symptom of fever occurred today, and that was the beginning of his assessment. We are aware that he has been in close contact with his fiancée and with 2 friends. All 3 of these contacts are healthy and are being quarantined. The governor mentioned an additional person. This person was a driver of an Uber car with whom the patient had no direct physical contact and is considered not to be at risk. Today, when he reported fever, he contacted the health department. We contacted EMS, and he was brought to Bellevue Hospital. The test for Ebola was conducted on blood drawn here at Bellevue Hospital and conducted at our public health lab. I think that I should turn over to Dr. Zucker to talk about the process of his transfer. We really are confident that all of the protocols that we've worked so hard to put in place for communications with all levels of our public health system, with our emergency medical system, with our public health system, have worked as well as we expected them to work, and we're glad that the patient is safely here at Bellevue Hospital. Over to you, Dr. Zucker.